Good morning, and thanks so much for joining in. There's still a lot of unknowns around a vaccine, such as when it will be released, what the federal government's planned supply chain management vaccine allocation process will be, and if there'll be funding allocated to states to assist with our distribution efforts. However, at the state level, we'll be doing everything we possibly can to make sure that Montana is prepared for when a safe and effective vaccine arrives to our state. We've now submitted a draft of our COVID-19 vaccination plan as required to the CDC and expect to receive feedback later this month. This is just the first step in what will be an ongoing process as we work closely with local public health and healthcare facilities to effectively distribute and dispense a vaccine. We're in the process of forming a vaccine coordination team, which will serve as an advisory group of experts to assist the Department of Public Health and Human Services with refining the vaccination plan, ensuring that folks on the ground are ready to hit the ground running on day one. The team will include representatives from hospitals and rural health clinics, local health departments, tribal governments, long-term care and correctional facilities, pharmacies, businesses, educational agencies, churches, organizations that serve ethnic minority groups, community representatives, and more. We're not new to vaccine distribution, and in fact, we've been working on improving our last go-around to be prepared for the next event in Montana. In 2009, we executed the H1N1 vaccination plan. Since that time, I've worked on improvement plans as well as working with local jurisdictions to hold full-scale exercises. Information for the public about our ongoing process to prepare for vaccination distribution will soon be posted and updated on the covid19.mt.gov website. As we learn more about a vaccine that will someday be in our future, we'll continue to take the input of our expert Montanans, readily adapt our plan, and ensure that we can begin implementing the phases for vaccination distribution as soon as possible. But until that time, we must also keep focusing on our current situation in Montana and continue to address the challenges that lie ahead of us. One of the most efficient tools we have to support the Montana economy is through unemployment benefits for Montanans. Unemployment benefits have put money into the pockets of Montanans to pay their rent or mortgage, keep their homes warm, and put food on the table during this emergency. Additionally, benefits have injected dollars into communities and brought stability to local economies across the state. And when individuals receive unemployment benefits, they can continue to support local businesses and stop job losses from spreading to other industries. Montana Department of Labor and Industry has now paid over $1 billion in benefits to over 100,000 Montanans since the pandemic began. For every dollar distributed in unemployment benefits, there's a $1.90 economic output, or essentially $1 billion in benefits paid translates to $1.9 billion in economic output in Montana. The economic activity generated from UI benefits translates to roughly 4% of Montana's gross domestic product, replaces an estimated 5% of wage earnings statewide that would have been paid this year. It's clear that access to UI benefits served as a lifeline for Montanans and played an instrumental role in Montana's economic recovery. Additional dollars in the community contributed to Montana's steadily decreasing unemployment rate, which we announced today has returned to a near normal level of 5.3% for September. It's lower than the national average, currently of 7.9%. In September, total employment posted strong employment gains of 4,250 over the month. Total employment has regained over 48,000 jobs since the April recession low. Montana has been the 7th best state in job performance during the COVID-19 recession. In Montana, we've taken significant action to not only maintain but further the progress that we've made. A couple weeks ago, I committed $200 million in coronavirus relief funds to replenish the UI Trust Fund and ensure these benefits will continue to be paid to workers and families in need as we continue to navigate the virus and its economic impacts. In addition to preserving benefits, this effort prevented Montana businesses from having to pay rate increases of at least 85% next year. And when Congress didn't act after the $600 a week in extra benefits expired, I used state coronavirus relief funds to ensure that Montanans got the full $400 a week when the Lost Wages Assistance Program was available for that duration. In addition to prioritizing UI benefits, one of our top priorities is in managing this crisis has been to distribute funding from the CARES Act to keep Montana families, businesses, and nonprofit services afloat. Those efforts have resulted in 32 different relief programs we've created to respond across all walks of life to the economic hardships caused by COVID-19. About 97% of total CARES Act allocation has been committed, more than $723 million has been awarded. The Business Stabilization Grant Program alone has supported more than 10,000 Montana businesses, and across a suite of programs geared toward businesses and nonprofits, more than 14,000 businesses and nonprofits have received support from the state's coronavirus funds. Additionally, more than 1,200 families and individuals have received mortgage and/or rental assistance, allowing those Montanans to keep up with their monthly rent or mortgage payments and remain safely in their homes. We know things have changed rapidly over the last several months and could well change again, but economic data suggests that our state's on a long-term path toward restoring and expanding economic growth. Yet that stable recovery that economists predict is a great risk in at least two ways right now. First, while we've worked diligently to get folks back to work, make sure that the lights of businesses stay on, and shore up our trust fund to provide regular UI benefits, our progress toward economic recovery is certainly in jeopardy without action by Congress. In addition to the expiration of the lost wages assistance funding, Americans are beginning to exhaust benefits, and many federal programs that allowed more folks to access benefits, such as those who are self-employed, are set to expire at the end of this year. Without these benefits, consumer spending will drastically decrease, which harms our small businesses, and folks who've been getting by might not be able to continue to do so. Unfortunately, Congress has been unable to come to the table to provide the continued relief that's needed now, and certainly will be as we tackle this virus well into the future. This leaves a lot of unknown for workers should they find themselves temporarily out of work, or businesses should they have to temporarily close their doors. Second, our economic recovery is at risk by the Montanans and businesses not following the restrictions that we have in place. Now, Montana is not alone as we continue to see an alarming amount of new cases each day. Over the past week, nearly every state is seeing an increase in cases, and the majority of states have seen a 7-day high or peak. But we can do things the Montana way to get rid of this virus, and that means that businesses in Montanans, again, looking out for one another by playing by the same rules, which are the ones that we already have in place. There are businesses that are doing everything right. They care about their healthcare workers, the customers they serve, and their larger community. They care about their own workforce and not wanting to find their workers without a job by having to close down from not following the rules or introducing cases into their establishments. There are some that even go above and beyond, like Casey's Bar and Restaurant in Whitefish, which is voluntarily going back to 50% capacity and closing at 10:30 on Friday and Saturday nights, knowing that that outcome is better than having to again temporarily close their doors. It's not the Montana way should the businesses that are doing things right have to close their doors because of the bad actors who aren't taking the necessary steps to minimize the virus spread. The Montana way is slowing the virus spread. And it's a good thing for our entire community if we do so. Slowing the spread keeps schools open, which keeps parents in the workforce, which keeps those parents spending money at businesses, and so on. Most importantly, every Montanan stepping up right now to slow the spread will begin to reduce the strain that we're seeing on our healthcare workers. Here with us today is Charlotte Skinner, an ER nurse at St. Pete's, who's been on the front lines of caring for COVID-19 patients. Charlotte, thanks for being here today.
I'm Charlotte Skinner. I work at St. Pete's as a registered nurse in the PACU and the emergency room. Today I've been asked to represent frontline workers and share a little insight into how this pandemic has shaped our roles and how the public can support us. First, let me begin by saying the past 8 months or so have been really stressful, challenging, and full of day-to-day uncertainty. This is how we all feel, but as healthcare workers, whose responsibility is the lives of our family, friends, and neighbors, this burden has felt huge. All of our job stressors are just magnified as we learn to do things like CPR in head-to-toe PPE, or we learn new methods of putting patients on ventilators while the doctor's hands are inside a plastic box. Or as we have to explain to yet another tearful family member that, no, you can't visit right now, but we'll hold the phone up for a FaceTime call. Here's the thing about healthcare workers. We come from a huge variety of backgrounds, political beliefs, socioeconomic statuses, religions, but we've always found a common ground to stand on, and that common ground is called science, evidence-based practice, and a patient-first mentality. I have never and I will never run into the room of a patient in distress and ask them how they vote. Instead, I stand shoulder to shoulder with my healthcare team, and we work tirelessly to save lives. People in healthcare don't discriminate, and neither does this virus. I'm asking you today to stop segregating yourselves into maskers and anti-maskers, and to stand with us on the common ground of science and evidence, which is clearly telling us that masking works. We must do it consistently, diligently, and the majority of us need to participate. But if we can do this, it does make a difference. We need your help, Montana. Our hospitals are reaching a breaking point. We are on the brink of seeing a surge capacity like we have never seen before. And make no mistake, this will affect our ability to provide the best possible care. By masking, hand washing, social distancing, and following other public safety guidelines, we can prevent this from happening. So please, we are asking you, stand with us, stand against this virus. Thank you.
Thanks. I'll now open it up for questions for me, for Charlotte. We also have Jim Murphy, the head of the Infectious Disease Bureau, Dr. Greg Holtzman, the Chief Medical Officer, and Nick, an economist from the Department of Labor, if there are any questions for them. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. If the question that you had has already been answered, you can press 5* and it puts your hand down. First phone question.
Hi, Governor Bullock. This is Rachel Kramer with Yellowstone Public Radio. Thanks for having the press avail today. I wanted to check on a couple of things that you mentioned last week about helping counties and tribal government apply for the second round of funding to help cover the costs associated with more contact tracing and enforcement. And I wanted to check with you to see how much that pool of funding is, how many applicants have been applying for that funding, and how quickly they'll receive that funding.
So the pool of funding was the same as first time, $5 million. Notices went out to everyone that had received the first round. As far as the amount of dollars out the door on that, I'm not sure right now. We can try to get you that information though, Rachel. It's as soon as the application is submitted back, we'll be able to cut a check through Savers.
And so that funding could be coming through this month or early in November?
Yes. I mean, within days, there's no reason that it should take to October.
Okay. And then I was also curious, with the templates you mentioned, has that been put together, and have any county attorneys asked for that?
So I know, we have been, both my chief counsel's been in discussion with many of the county attorneys, and I think that those discussions are really ongoing. As far as lists of those that might have wanted sort of the templates, that I'm not aware of.
Okay. And sorry, I just have one more quick question. With the vaccination planning team meetings, will those be public?
Yes. The answer is yes.
Okay. All right. Thank you.
Next phone question.
Hello, Governor. It's Peter Christian from KGBO Radio in Missoula.
Hi, Peter.
Yes, sir. We had on our talkback show yesterday, we had an individual who works for one of the county agencies and deals with the public one-on-one, and said that they have dipped into their own pockets to get PPE equipment and have asked for reimbursement from the state. And he was wondering if any of the CARES money might be available to take care of some of those expenses.
Peter, I think like if individuals or county employees, as an example, are purchasing PPE, first of all, that we've actually been distributing through the Disaster and Emergency Services and providing dollars directly to the local governments, and that's both the cities and the counties, for any additional expenses that they have that relate to COVID-19. So there wouldn't be a program where individuals could get reimbursement through CARES Act dollars, but that individual should certainly speak to their bosses as far as making sure that the adequacy of PPE is present. And there's also a program for businesses is that they actually provide both everything from sanitizer to masks and some of the plastic sheeting to get reimbursements as well.
All right, thank you, sir.
Yep. Next phone question.
Hi, Governor Bullock. This is Maritza Giorgio with NBC Montana, and I'm wondering if you have a direct message for Flathead County residents after the health board voted against any new restrictions to deal with their surge of cases they're seeing.
Well, I think, look, I mean, anytime that you're hearing from both the head of the hospital and the school district of the need to start taking this more seriously, I, like many Montanans, was discouraged with the actions of the Flathead County Health Board because we are seeing significant numbers there. So we do know what needs to be done. More than anything else is actually to follow the directives that have been put in place to date. And, you know, on the one hand, this is, I think there was notions of individual responsibility, but our individual responsibility is actually not only to take care of ourselves and our families, but the greater community as well. And we know that the steps that need to be taken in order to get there. Next phone question. Oh. Go ahead, Jonathan.
Sorry, Governor Jonathan Ambarian from Montana Television Network. Once again, we had a pretty high test positivity rate today, and I know that last week we're in here and we're saying it's basically because we're testing people who are contacts already more than anything else. Do you feel like we're doing enough testing right now? Is it something, I mean, for a while in the summer we were doing more asymptomatic testing. Is it something we need to be getting back to? Is it a staffing issue, I guess?
Do either as far as the degree of testing, Dr. Holzman, then I'll answer as well if I'll play clean up.
I mean, we're really being focused on our testing that's going on out there. We want to make sure everybody that needs testing can get testing. I think one of the biggest points that is shown by this very high positivity rate is that there is a lot of disease out there. And so it gets back to the exact same things that we've been talking about need to be put in place and done by the community, as Charlotte so well stated, in order to bring those numbers down. But hopefully nobody who needs testing is feeling like they're not getting testing, because we're out there and doing that.
Yeah, and I'd only add, Jonathan, like back in the early summer, I'd said like a target of 60,000 tests a month. I mean, my guess is, I didn't pull it for this, but we're probably about the 90,000 a month. So from my perspective, it's not just about getting testing out there, and there has been continued some sort of sentinel testing, but what we really need to do with this much virus in our communities is make sure that every close contact of a positive is tested and is quarantining till then to limit the community transmission.
Governor Jessica Watts, ABC, Fox, Montana. A lot of business owners here in Montana are not feeling like they have the support of local leaders when it comes to enforcing your mask mandate. So what do you expect local businesses to do when they're caught in the middle between the statewide mask mandate and the lack of enforcement at the local level?
Well, certainly, and look, I've heard from local heads or a head of a chamber of commerce saying that there has to be additional enforcement. So I would encourage every one of those local businesses to directly reach out, right, to their county attorneys and law enforcement and their public health, because the enforcement by and large happens at the local level. Next phone question.
Hi, Governor. This is Nora Mabey from the Great Falls Tribune. Senator Daines sent a letter to you today citing a legislative audit about CRF resource distribution to tribes. It says tribal governments have received less than $600,000 and the Crow tribe received $0. I was wondering if you had a comment on that.
Sure. I mean, the claims made in Senator Daines' letter are actually patently false, can be proven false by taking a quick look at the transparency dashboard used to track CRF dollars. Tribes were directly eligible for several of the 31 coronavirus relief grant programs, and then tribal members, local governments, nonprofits, businesses eligible for have received grants through those grant programs. In addition to the grant programs that we have, tribes and individual members are eligible for the tribal nations also in Montana directly received $208 million from the federal government from the CARES Act. Of that $208 million, it was $173 million was put into a coronavirus relief fund specifically for Montana tribes to utilize as they see fit. So that amounts to about 2.5 times the per person ratio as the state was allocated through the state's coronavirus relief fund. Last week we had tribal summits, spoke to nearly all of our tribal nations, and several of them actually, they repeatedly mentioned they'd have difficulty spending all of that money by December 31st, deadline set by Congress, if and unless then Congress actually gets its act together and extends it for tribes. And if the senator wanted to help the tribes, then he'd probably stop trying to play politics and do his job in Congress to extend that deadline. Sure, tribes can best use those dollars to keep their communities safe and healthy. I noted that he also falsely claimed that the Crow tribe didn't receive any coronavirus relief funds. The Crow tribe was actually encouraged multiple times by our Department of Public Health and Human Services staff to apply for the public health grant and was given a deadline extension, still has not yet applied. We've since announced that second round of public health grants, made it clear that the Crow tribe's eligible for both rounds of grants if they do so choose to apply. Beyond that grant program, over $4 million in CRF funds have been awarded to Crow tribe members and citizens of Bighorn County to support small businesses, local governments, and more. Additionally, the state's provided PPE, personnel, school safety supplies at no cost to tribes, including the Crow Nation. Crow Nation's received about $560,000 worth of PPE, school safety supplies, personnel, and testing from the state.
Thank you so much.
Thank you. Next phone question.
Hi, this is Perrin. Hi, this is Perrin Stein from the Bozeman Daily Chronicle. Given that some counties with high levels of cases aren't implementing new restrictions like Flathead County, what are your thoughts on any sort of new limits needed at the state level at this point?
Well, I think that it really is certain counties that need to actually take this more seriously, and the first start would actually be following and enforcing statewide restrictions that we have in place. And it doesn't necessarily make sense to put blanket statewide restrictions that would impact businesses and counties and communities that are doing it right.
Thank you.
Thank you. Next phone question.
Governor, this is Chad Sokol at the Daily Interlink. I was curious, understanding that the vaccine availability will be pretty limited at first, do you have any clarity from the administration or from the CDC as to how they'll distribute the vaccine, in which, how they'll prioritize where supplies of it get sent, and do you have any concerns about that process?
Do what, Jim? Why don't I turn it over to Jim Murphy, Infectious Disease Bureau head, and then I'll do a little bit of follow-up.
Sure.
The situation with the vaccine supply is evolving rapidly, so we're keeping a close eye on it. But right now, our understanding is that the priority populations are going to be healthcare responders, elderly, our American Indian tribes, and people with underlying medical conditions. If the vaccine supply comes out initially limited, that's going to be challenging to make sure that we can allocate that fairly across the state, and that will be one of the challenges that we face. We are hopeful that there'll be enough vaccine supply around that first phase will move fairly quickly and we'll be in a better position to broaden the vaccination effort. So it's something we're watching closely. Not a lot of firm timeframes coming out on the vaccine distribution yet, but that's why it's important that we spend the time now planning with our partners. We do know that the federal government is going to allocate vaccine directly to the states for distribution, but they're also going to allocate directly to tribal areas if they chose to take that route. They're also going to work closely with some of the private sector, most notably CVS and Walgreens pharmacies, to help with the vaccination effort too. So it's promising to us that we'll have a lot of partners in this effort, and we've done this before, and I'm confident that we'll be able to carry this off again.
And I'd only add that I do have concerns, and I'm not unique in that. I mean, it was last week, the National Governor Association, representing all the Democratic and Republican governors across our country, sent a letter to the administration saying that we have to be close partners in this. Look, there's still not a lot of clarity, first of all, of what might be the first vaccine. There's some discussion that if one comes out, right, it has to be kept 80 degrees below 0 Celsius until effectively 30 minutes before the vaccine is distributed. Well, if so, that's going to take, as but one example, significant resources on the ground, both from a capital investment as well as people. So I really am pleased with the efforts of the Department of Public Health and Human Services, and not just them alone, but as they've worked with all of their partners in putting together this vaccination plan, the draft plan, but there are still a lot more unknowns than what is known right now. Not only when it comes to the timing, but sort of all of the essential qualities that we'll have to put into our calculus. Please.
Obviously, not everyone is going to be able to get the vaccine upon initial roll. Has there been any discussion as to prioritizing who gets the vaccine first and who
Yeah, and that's what Jim Murphy just sort of went through, that the plan provides right now for vulnerable populations, healthcare workers, tribal communities. But, you know, yeah, there's right now no daylight on how many vaccines or when. I'd like to just close by thanking Charlotte for not only being here today, but the work that she and so many others have been doing literally every single day since mid-March. And if all of us at times feel fatigue from this virus, imagine what an emergency room nurse feels, or other frontline healthcare workers. And I think that Charlotte's message is one that I hope that we will all take to heart. We do know, look, the numbers are concerning. While Montana is not unique in increases, Montana is unique in as much as that it's the individual Montanans and all of us working collectively that can actually curb the spread of this virus. Like many folks around parts of the state, I woke up Saturday morning to snow being blanketed, and recognize that this will just continue to compound some of the issues that we're facing, with more people spending time in close contact indoors. So would encourage, if we take one thing out of this morning's discussion, it's greater than the preparation for the vaccination plan or our unemployment rates. It really is what Charlotte shared with us, in as much as that they need all of us to do more. Thanks so much, and we'll probably provide another briefing near the end of the week.